Donor Egg Program or In-Vitro Fertilization with Donor Eggs. What is in-vitro fertilization with donor eggs? In-vitro fertilization with donor eggs or egg donor IVF is a fertility management choice for people who can't utilize their own eggs for any reason. There is a greater success rate in this procedure than in non-donor IVF when using a screened egg donor. While egg donor IVF suggests that the intended mother will not be genetically related to the child born out of such a procedure, the intended father will be unless a sperm donor is also utilized. When are donor eggs recommended? During traditional IVF treatment, the woman is administered fertility medicines to stimulate egg production in her ovaries. Once the eggs have fully matured, they are harvested by the healthcare provider using an ultrasound-guided needle. The retrieved eggs are placed in a petri dish along with the sperm cells for fertilization. Embryos developed out of such fertilization are afterwards transferred to the intended mother's uterus or frozen for a future cycle. But what if the intended mother's ovaries aren't able to produce enough eggs for conventional IVF? What if the intended mother's ovaries are missing entirely? In these certain situations, an egg donor cycle of IVF may be recommended, and also in situations like infertility owing to advanced age, premature menopause, ovarian failure at a young age, low-quality eggs, chemotherapy-induced infertility, high risk of passing on a genetic problem. Following satisfactory patient counseling, the egg donation IVF cycle includes the following steps. Step 1. Recruitment of egg donors and biophysical matching with recipient couples. The first step is to find a suitable anonymous egg donor recruited through legitimate donor agencies. Biophysical matching, that is, the examination of medical and genetic diseases, is conducted in the selected donors. Stage 2. Consent. Before an egg donor is involved in the egg donation IVF process, she needs to sign a legally binding contract agreeing to oocyte retrieval. At the same time, she is entitled to receive all important information related to the known risks of egg donation. Stage 3. Insurance. An agreed amount of insurance coverage for the egg oocyte donor is provided by the commissioning couple against her service. Stage 4. Stimulation. The donor is given medication to stimulate her ovaries to produce multiple good quality eggs during a cycle to increase the opportunity for pregnancy. Ovulation induction is used to stimulate egg development to increase the number of ovulations. Stage 5. Egg retrieval. Once egg maturity is achieved, the donor is scheduled for the egg retrieval. The eggs are then extracted from the donor using a needle connected to an ultrasound probe that is inserted into the vaginal tissues. The eggs are then suctioned or gently aspirated from the ovaries. Stage 6. Fertilization of donor eggs. Sperm from either the recipient's male partner or a sperm donor is used to fertilize these eggs in the laboratory to form an embryo. The eggs are put in a petri dish with sperm cells for the eggs to be fertilized. Stage 7. Preparation of endometrium of the commissioning or recipient couple. In an egg donor cycle, estrogen and progesterone are administered in a sequential regimen that mimics the endocrine exposure of the endometrium in the normal cycle of the endometrium of the commissioning or recipient couple. Stage 8. Embryo transfer. The best embryo or fertilized egg is chosen using artificial intelligence or AI protocol and transferred to the uterus or womb of the intended carrier, and hopefully a pregnancy is established. Stage 9. Pregnancy. The intending mother or the gestational carrier is checked for pregnancy 9 to 11 days following the transfer. If she gets a positive pregnancy test, she will keep taking estrogen and progesterone supplements until she is around 10 weeks pregnant. If the pregnancy test comes out negative, the doctor will plan the next course of the plan of the treatment cycle. How many oocytes or eggs may be obtained from an egg donor during a treatment cycle? An egg donor can provide a fixed number of eggs legally determined in an IVF treatment cycle. The primary function of an assisted reproductive technology bank in India is to 1. Screen gamete donors and conduct the screening, collection and storage of oocytes. 2. Retrieve oocytes from qualified and legitimate donors as specified by regulations. 3. Obtain oocytes from females between 23 years of age and 35 years of age. 4. Examine and confirm the egg donors has been medically tested for any diseases. 5. Obtain all necessary information of the oocyte donor. 6. Preserve the unused oocytes to be used on the same commissioning couple. 7. Provide professional counseling to commissioning couple and the egg donor regarding the implications, chances, risks of the egg donation cycle. 8. Make the commissioning couple and the egg donor woman aware of the rights of a child born through donated eggs. 9. Keep every information about treatment confidential. 10. Maintain a database as per the National Registry for any medical emergency in future. 11. Maintain a grievance cell for both the commissioning couple and the egg donor. The age of the egg donor, the egg retrieval technique, the quality of the sperm and the recipient's overall health are all factors that influence success. What are the important facts of an egg donor cycle? For the intending parent, the child born through a donor cycle shall be deemed to be a biological child of the intending couple, and the said child shall be entitled to all the rights and privileges available to a natural child only from them. For the egg donor, a donor shall relinquish all parental rights over the child or children born from her gamete. As per the Assisted Reproductive Technology Regulation Act 2021, the donor will be provided with insurance for her donation. Note: both the commissioning couple and the egg donor should seek counseling to address emotional issues and a skilled advocate to safeguard their rights and the interests of the potential children born out of such. There is no provision of any financial compensation for egg donation.